Hi everyone, my name is Longino, and I'll be focusing on a few key points regarding the Affordable Care Act after watching the Bipartisan Conference on Healthcare Reform. In the 2 short years I've been a registered nurse, I've watched how the Affordable Care Act and the formation has greatly affected our country thus far in regards to insurance reform. The purpose of this legislation is to ensure that all Americans have access to affordable health insurance plans. Some highlights of this proposed plan are that it bans health plans from denying coverage because of pre-existing medical conditions. It bans dropping the coverage of people who become sick while being insured. And it bans charging higher premiums because of existing health conditions. One of these benefits that intrigue me the most is the part about not dropping coverage due to the pre-existing conditions. As a nurse thus far, I have seen how complex our patient population can be in this present day and time. Patients have many more comorbidities now than they have ever presented with in the past times. It's hard to believe that insurance plans in the past could possibly drop coverage on patients like these due to their pre-existing conditions. However, at the same time, forcing these insurance companies to pick up all these patients disregarding their condition can possibly drive up everyone's costs as well. The exception to this rule would be for a person to have a grandfathered coverage plan which is bought individually and is not employer based. Another impact that the Affordable Care Act has is the expansion of young adult coverage. The legislation states that if an individual is under the age of 26 years old, he or she may be able to be insured under a parent's plan. The criteria for this arrangement is that you either have to be married, not living with your parents, attending school, financially independent, and eligible to enroll in your employer's plan. I meet the criteria for this arrangement since I am 24 years of age, not living with my parents, attending school, and I am financially independent. As an individual, it greatly aids me in providing great health insurance coverage for myself at low cost. However, even though this greatly benefits me personally as an individual, it might not necessarily aid in cutting healthcare costs in regards to the whole country. Young adults up to the age of 26 typically have fewer health problems and are more unlikely to require healthcare coverage near as much as the aging population would. Another level of the Affordable Care Act I would like to discuss is the incorporation of free preventative care into our plan of cutting healthcare costs and limiting extended coverage for the insured. Examples of preventative care are screenings such as those for blood pressure, cholesterol, mammograms, and colonoscopies. This also includes vaccinations and preventative services for women's health. I feel like a lot of the healthcare crisis today involves a lack of preventative care plans in our past. By encouraging Americans to utilize these free services, they will be less likely to develop medical conditions secondary to deficiency in appropriate health behaviors and also self-awareness. In my opinion, shifting our patient population towards a proactive approach towards health instead of a reactive one can greatly benefit us on many different levels. At the beginning of the course, I must admit I knew very little about health policy and what it means to my profession. One important thing I learned was the difference in legislation and regulation and how they are both synergistically incorporated to shape health policies governing my practice as a future nurse practitioner. Another thing that I learned was how important ethics is in regards to adhering to policies. Many policies may be complicated by many ethical dilemmas, and as advanced practice nurses, we must be able to do what is consistent with policy and is ethical in our eyes as professionals at the same time. The last thing I learned that I feel is very important is how to access information about current health policies. This involves utilizing research databases, many various publications, and appropriate forms of media to gather the appropriate information. I've had a great time this summer in this class, and I feel like learning more and more about health policy will be an important aspect of my future practice. I've enjoyed all of your posts and videos, and I wish all of you the best of luck for the remainder of your courses. Thank you.